Nurse Choma, and I am the founder of ChoosingNursing.net. And today I'm going to be talking with you about cardiac emergencies on the NCLEX exam. So hopefully you have a paper and pen ready so that way you can begin to take some notes. So let's go ahead and get started. So first, before I get into what the emergencies actually are, I think it's important to first define or describe what exactly is a cardiac emergency. So pretty much this would be some type of complication that occurs to a patient that involves the cardiovascular system, which obviously includes the heart. So try and think of it in that regards, that a cardiac emergency is some type of complication that is also life-threatening, meaning that if you don't respond immediately, the patient can die. And that's the reason why the NCLEX exam would want to put this on the exam, because it's trying to see if you are a safe nurse. So let's go ahead and talk about the very first, and these are not in any particular order as far as them one being more of a precedent than others. I just want to share them with you. So the first one is going to be cardiogenic shock. All right, cardiogenic shock. So there are different types of shock, but one of them is a cardiogenic shock, which pretty much involves where the heart is not able to pump effectively, and as a result of that, the body goes into shock. So one thing that you should be aware of when it comes to patients that are in shock is that you're going to see very, very low blood pressure, but also high heart rate. So cardiogenic shock is pretty much where the heart is failing and it's not working effectively anymore, and as a result, the patient is now in shock. Now, I want to talk to you about some of the type of patients who suffer from this condition more, because for the exam, you do need to be able to recognize who would be at risk, because what the test does is that it doesn't merely list the risk factors like I'm going to give to you right now, but instead it will describe a patient that meets those particular factors. So here it is, and this actually part surprised me a little bit, but female, so women are more at risk to having cardiogenic shock than men. Also being elderly, that's 2. And then also, of course, patients who suffer from multiple comorbidities. So patients who have diabetes, kidney disease, high blood pressure, they're going to be at higher risk for cardiogenic shock. And cardiogenic shock usually occurs after, as far as like the patients that are at most risk are patients who have a heart attack. So this is what you would see in the hospital setting. If the patient has a heart attack, and let's say it's a very major heart attack, and they come into the hospital setting, and so they're a woman, they're maybe in their 70s or 80s or so, or even 60s, and now they begin to show these particular symptoms would indicate that they are going into cardiogenic shock. So remember, these are also the symptoms you would see with shock in general, really. So low urine output, which is also known as oliguria. You're also going to see, like I said, that low blood pressure. And then also rapid thready pulse. So meaning that the pulse is very fast, but it's very weak. That's pretty much what thready means, so in case you never really understood. Thready just means that the pulse is very weak. Okay, so these are the symptoms that you're going to see: the low blood pressure, the low urine output, and then the pulse. So that's the first emergency, cardiogenic shock. All right, now the second emergency, the second cardiac emergency is going to be cardiac arrest, right, which is also known as a heart attack. So in this situation, this is a little bit different as far as the patients who are at risk. Now, these are going to include patients who have high blood pressure, patients who have coronary artery disease, which is also known as heart disease. So pretty much what happens when somebody goes into or has a heart attack, there is a clot, and it's like a built up a plaque in the arteries, and it stops. It impedes the flow of blood through the coronary arteries in the heart. So that's also why patients who have hypercholesterolemia, so high cholesterol levels, are also going to be at risk too when it comes to cardiac arrest. So blood pressure, having the high cholesterol, of course if they have diabetes, that puts them even more at risk. That's a very common emergency that you would see almost all the time clinically and on the NCLEX exam. So the thing about it, it's not necessarily what you just want to be aware of what it is, but you should be able to recognize who's at risk, you know, what type of symptoms you would expect to see. So patients who like a recent cardiac arrest, so literally they're having a heart attack right now, or they're, you know, like literally it's happening right now, you're gonna see them. They're gonna be literally clutching their chest. So especially men, that's typical more with men. Like they'll be clutching their chest. Of course, obviously they're having chest pain, and then also in addition to that, they're also going to have sweating. That's one of the hallmark signs of cardiac arrest. Is that there's like major, heavy, profusely sweating, and then also pallor. So they're very pale in their skin. They look very, very pale. Remember, all this is happening because literally just kind of imagine there's a sudden stop of blood flow in the heart. That's pretty much what cardiac arrest is. It's a sudden stop of blood flow through the heart, and that's resulting in those symptoms. So because of that reason, they will also have difficulty breathing as well. So that's another symptom that you would see with patients who have a cardiac arrest. Okay? So now the third one, all right? The third cardiac emergency that you want to be aware of when it comes to the NCLEX exam is going to be aortic dissection. Okay? Aortic dissection. Here's the thing. Because I think a lot of people are not familiar, or maybe you never heard about this, but it is unfortunately something you would likely see on the test. So an aortic dissection is pretty much where there is a tearing of the aorta. Okay, there's like a tearing of the aorta. So we know the aorta is a major vein, you know, pretty much that travels and passes through the heart and the rest of the organs in the body. So pretty much there's a tearing of the aorta. So you can see, once again, if we don't respond quickly, these patients can die because of the rupture of the aorta, which will result in sometimes decreasing the blood pressure, and this will cause worsening symptoms. So let me share with you some of the patients who would be more at risk for this. So patients who have a history of high blood pressure, they're going to be at greater risk. And so you're going to see high blood pressure patients, pregnant women. So women that are pregnant are also at high risk. Patients that smoke, patients that use cocaine, that's also a greater risk. So you can see why it's very specific. It's not the general population. And then also one more thing, major trauma. So some type of major trauma that occurs as well. So the symptoms that you're going to see with patients who have aortic dissection is going to include, keyword here, sudden chest pain. So sudden chest pain or sudden back pain, because think about where the aorta is, right? So that would explain why it's sudden chest pain or sudden back pain, because of that tearing of the aorta. So the symptoms that you're going to see with these patients is going to include, aside from the chest and the back pain, you're also going to see vomiting, right? They'll throw up. They can also be diaphoretic as well. That can also occur too. So those are the most common symptoms when it comes to aortic dissection. All right. Now, the last thing I want to mention too, as far as these particular emergencies, when it comes to the exam, you want it to be where you can recognize the symptoms, right? You can recognize the symptoms, and you want to be able to identify how to respond if they do occur. So the exam isn't always going to tell you the name of the emergency, but it's going to describe the symptoms, and then you have to be able to make your nursing judgment and determine what emergency it is. So those are the 3 important things that you want to be aware of when it comes to cardiac emergencies.